Hi, Dr. Martin here. I hope you're all having a wonderful day. I want to tell you about a patient encounter I had about a week ago. A patient came in and she was experiencing malaise, just a general feeling of discomfort, fatigue, and body aches. During the history process, we found out that she had gotten her second dose of the Pfizer vaccine. She got that on Wednesday. On Thursday, she had a fever, cough, body aches, general feeling of discomfort, and fatigue. And so by Friday, all she had left was the body aches, the fatigue, and the general feeling of discomfort. And so she was concerned that she was going to get everybody infected because she'd gotten the vaccine. I had to explain to her that that's not really how vaccines work. Basically, vaccines are going to have some kind of component from a microbe, a bacteria, or a virus, and they're going to activate an immune response. Now, it could also be a dead virus or a virus that's been changed or altered to make it weak, so it's not really going to be replicated in the cells. So that could be it as well. But it's basically being used to create an immune response. So the person's not actually infected, so to say. All right, so I told her that there are some herbs and things like that she could possibly use, because if we look at how a vaccine works, vaccines have been shown to activate the production of a transcription factor, which is basically a protein. And the transcription factor, or the protein, is going to interact with our genes, our DNA in the genes, and it's going to promote an immune response. It helps to upregulate the production of white blood cells and things like that. It also has a regulatory response on the immune system. And it's also going to promote the production of chemicals associated with inflammation. And so I let her know that this transcription factor is doing this, and that the one that I was talking about in particular is nuclear factor kappa B. So nuclear factor kappa B, very important for immune function and creating an immune response. That's what you want with a vaccine, because then that way you're going to have immunity to whatever the virus is that you may encounter. However, with the nuclear factor kappa B getting turned on, it also is going to increase the production of inflammatory chemicals. And one of the inflammatory chemicals that's going to be increased is prostaglandin E2, which is considered to be a local tissue hormone. So it doesn't really act like a hormone which travels throughout the body, it acts locally on the tissues. And prostaglandin E2 is associated with the production of a fever. But our inflammatory process is going to be activated with our immune system. Okay? So that's the big thing. And so there's this link between inflammation and immune system function. So I explained to her that there are certain herbs and things like that that she could use to help to reduce the activity of nuclear factor kappa B and help to reduce some of the discomfort that she's experiencing. So one of the herbs that she could potentially use that I told her that was an option was turmeric. Turmeric, fantastic, very good at reducing nuclear factor kappa B, very strong anti-inflammatory. Boswellia, also another one she could have used. Cat's claw, a good one for anti-inflammatory effects. Vitamin D could be used for reducing nuclear factor kappa B. Bromelain. Also, acupuncture itself can reduce nuclear factor kappa B. And so I gave her the options of what we could potentially do. She came back, she got treated with acupuncture, and she felt much better after she was treated. So as far as the vaccination is concerned, if there is a patient of yours that decides to go get the vaccine, or if you yourself decide to get vaccinated and you start having some of the side effects, you can use some of these herbs or potentially go get some acupuncture, and it could help to reduce the inflammation that you're experiencing. And overall, it should make you feel better. All right, so hopefully that was helpful. Have a good one.